My name is Erica Williams, an executive leader with a 25-year career in the healthcare industry. The last 15 of those years, I've led IT teams for large health systems and currently serve as a market CIO in Texas. I'm passionate about developing the next generation of leaders and leveraging technology to improve the clinician and patient experience. Welcome to This Week Health, where we host channels and events dedicated to transforming healthcare, one connection at a time. Our Town Hall podcast series, Road to Flourish, explores the inspiring career journeys of executives in healthcare. Whether you're starting out, seeking growth, or feeling stuck, this podcast aims to empower you. Let's jump right into today's episode. Hi, welcome to Road to Flourish. My name is Erica Williams, and my guest today, I am so excited to introduce you to. She has over 25 years of leadership and technology experience, leading the design and implementation of information systems that support business growth, system advancement, clinical service operations, and quality performance improvement oversight. She has her doctorate in business administration from Walden University, specializing in leadership, strategic management, and organizational development. She's a certified chief information officer, certified Lean Six Sigma Green Belt, Microsoft Certified System Engineer, and Certified HIPAA Privacy Professional. So I'd love to introduce you to Dr. Keena Taylor, the CIO of Innovation Care Partners. Welcome.
Thank you, Erica. Thank you so much for the warm introduction.
Yeah, so tell us about your current opportunity and where you are today with Innovation Care Partners.
Sure. So I'm currently serving as the CIO for Innovation Care Partners. I've been with the organization now for about 2 years. Innovation Care Partners is a member of the Honor Health System here based in Scottsdale, Arizona. I oversee a traditional verticals within technology. So I have our infrastructure and technology services. I do have a team of application developers. So I have our application DevOps team and clinical engineers. And then most recently, we launched a business and data intelligence vertical where we're spending a lot of time on IT transformation. Our organization actually has developed and delivers to our members a health information exchange, which has been very successful. So we do have a team that support that HIE environment. So we have, while a ton of data, we are certainly working to make sure that we're able to transform and leverage that data for meaningful insights to drive our business forward. I enjoy the work that I do and with the teams that we're working on. So we have been engaged in several different areas within technology, whether it be embracing and launching efforts around artificial intelligence, as well as some of our patient-facing work around development applications that we've created in-house for supporting the value-based care populations that we serve.
You guys are busy. I love it. And I love that you stated that you love what you're doing. We had talked a little bit before our meeting today and just how important it is to just love what you do. And that's exactly where you are today there. And I love that. Tell us a little more about the organization itself. Who all are you caring for? What type of organization?
So our goal is really to help our members, our practices, our physicians, and our patients that we serve within the community thrive. And we do that through leveraging technology and to help transform the healthcare delivery models. So as part of the ICP Clinically Integrated Network, or our Accountable Care Organization, we have over 2,200 physician members. We're a hub that really manages the populations of over 280,000 lives. As part of our ACO, we focus on making sure that our practices, our patients, our physicians, that they have the tools and resources to deliver value-based healthcare, focusing on that superior quality and those patient-centered services so that we can manage those patient populations throughout their transitions of care across the board. So we have a really great care coordination team that's in place to help affect and manage those patients as they navigate the health system. We know that can also be very challenging. We're also looking at ways that we're able to support and align to the AAA so that we're providing quality care, managing the cost of those treatments and services that we provide to our patients, and helping patients really navigate, as I mentioned previously, the healthcare system. Having been a patient myself, it can be tough, particularly for those that have not and do not have experience with patient navigation through our healthcare systems and services in the United States. So being able to have those team of care coordinators who are readily available to service and help those patients through those aspect of their services that they're providing from the care coordination side of the house has been very beneficial.
Yeah, the aspect of actually being a patient within your own organization or another organization brings a significant perspective change, right? If you're going through something or have gone through something significant from a health perspective, or if a loved one or a friend has as well. So I'd love to learn a little bit about your journey. So tell me about a time when you knew healthcare was right for you. So when did you know that this is where I'm supposed to be? This is the right career path?
That's a very interesting question because I would say early on in my career, I did not know that. So I started my journey in my first foray into healthcare. I was a pre-med student at Tulane. So growing up in Louisiana, that was the thing. You're going to do an engineer, you're going to be something in the medical field, a doctor, right? So that was my upbringing. So when I started studies, I realized early on that I did not want to be a physician.
Okay.
And ended up joining the Air Force. And that's when I really got into technology. So I was what they call a 3 Charlie in the Air Force and really loved the structure, really loved my time serving armed services there. It was primarily overseas. It wasn't until I had a medical condition and had to be medically honorably discharged from the Air Force that I got into the healthcare sector. So things come full circle. So my career started overseas in Okinawa, really getting into healthcare with a company called SAIC at the time. And it was really going full circle from technology and bridging that experience that I gleaned from the military in IT and with the goal of serving others in the healthcare space. So it had really come full circle. And that's when I realized that this is what I'm passionate about. I love solving complex issues. I love interacting with people. And I was able to do and fulfill the underscore, the premise of what healthcare professionals do in a different manner, but still serving others. So I found my home. I found my happy place.
Yeah, I love hearing people's journeys because they're all different. Some have a very personal healthcare journey, and some, like myself, I think it's just my destiny. I ended up here. It's where I'm supposed to be, but it wasn't from a specific life event. So thank you for sharing. How have you navigated a major transition or shift in your career where it was changing roles or moving to leadership positions or exploring new fields within the healthcare industry?
I would say one of the most defining moments for me in my career, certainly early on as a leader, was when I was with an organization where I was able to expand and grow beyond the CIO role or the technology space, if you will. When I was with St. Anthony Shawnee, which is a part of the SSM health system, before they became a member, actually, I was their CIO for the organization. And one of the things that we were challenged with, and we had a very good leadership team at that time. And we were challenged with making sure that we were embracing technology to really drive performance and not just for the sake of having something new, right? The new shiny toy, if you will. We had some operational challenges from a clinical standpoint. We're looking at how do we continue to grow our network and really expand our market reach. I asked our CEO, because we're having specific issues in the pharmacy at that time, looking at, we had contracted services in the pharmacy, and it just really was not working to the benefit of the organization and certainly to the benefit of our patients. So I thought, let's bring our pharmacy services in-house. Our CEO at the time took a chance and was like, you have a plan? It's yours, you own it. So I was able to really get the additional clinical experience, business experience, overseeing that clinical department to bring those services in-house, working with business leaders in the community, making sure I'm engaging with HR to successfully transition and onboard those staff. So that was really the door opener and really that defining moment that allowed me to get the operational experience in healthcare that I think makes me or made me a more effective technology leader. So it was really identifying and understanding the various aspects of the healthcare services and then making sure that we are introducing appropriately technology to help drive performance, to help drive our goals for the organization forward. So I still look back very fondly on that moment in that time. And that really set me up for other roles that I felt comfortable being able to pursue.
You gave a really great example of a characteristic that I have shared with my team and others. It's solving a problem in the gap, which basically means you are diving in, you see something that needs to be addressed, you speak up and you solve for it. And it's those types of situations, exactly what you explained, that set you up for success and brought visibility and helped to elevate you to other opportunities. And meanwhile, bringing a lot of benefit to the organization you were in. So I love that story.
Thank you. And it's something I share with others that I may mentor. It's like, even although we work in technology as a CIO, whatever your role is, we are business leaders and we're in the healthcare space. So I always encourage people, regardless of what industry you're in, to really dig in and learn the business that you're functioning in, and don't put yourself in a box as solely a technology leader or a CIO or whatever your title is. That provides you opportunities to grow and expand and perhaps do a lateral move. I've had opportunities to also work as a COO, CIO for other organizations. And it was not until that defining moment that I took a chance, not only on myself, but that other leaders took a chance on me to be able to grow and explore and kind of grow beyond the role of IT, that opened doors in future roles for me. So that was really exciting. It really changed my approach to leadership. It changed how I deliver services in technology. So this really was something that I can look back on and say this was the moment.
I was challenged early in my career to that point of learning the business to view myself as a healthcare professional. And at first, that felt very awkward to me because I'm an IT person. My degree is in MIS. I am not a clinician. However, once it sunk in, it was game changing, and was game changing for others who also embraced that I am not an IT person that happens to work for a healthcare organization. I'm a healthcare professional that happens to provide IT services.
Absolutely.
And that is so important from a culture, and really embracing and being successful in IT is just being a part of the team. And it's all about patients. It's all about healthcare.
Absolutely.
So what personal qualities or characteristics do you believe have been most important in helping you to succeed in your career?
I would say being open-minded, willing to take a chance, willing to take that risk, and being able to navigate or change. I mentioned earlier that I love being challenged. I love complex issues. I like the structure of being able to organize those and compartmentalize these into chunks where people can understand and still execute and deliver. So I think the characteristics for me and for anyone, I really believe, is being open-minded, being willing to take that chance or take that risk, learning and being and excelling in your skill, whatever that may be, whatever your trade is. And in this case, for me, is being that business leader that, to your point, that provides technology services, but trying to aim to be the best in your field and being open to always identify what are those new and emerging technologies in this case. It could be new and emerging ideations that's coming out of your field so that you can stay abreast on what's happening and being able to respond to changing your respective areas. So being flexible, being open-minded, and wherever possible, being that change agent.
So on the the flip side of that, so those are the aspects that made you successful. Now, likely you're looking for the same types of things when you're hiring, but what would you say are the key characteristics that you're looking for in your team when you're looking to hire?
I look for expertise in their field, of course. I look for people that are team oriented as well as results oriented. I look for people who's able to navigate and respond to change appropriately. In healthcare, particularly in IT, that's a common part of our day-to-day. Is something is always changing. We're always responding to challenges or issues that we're trying to solve. So I look for people that's innovative, who embrace and enjoys collaboration. I look for people that care about people, that put people first. It's very important for me that regardless of the technology or the field that we're in, that we're mindful about the people that we're serving and that who supports us. So for me, being people oriented, putting people first, caring about and meeting them where they are so that they can be successful in their journey, staying connected. Those are the things that I look for and try to pull out those traits and examples as I look for future candidates as well.
I think it's really important to share those types of things as people are early in their career looking to be you when they grow up, and just what are those things that, folks are looking for, and how do I portray those things in the short amount of time I have in an interview? Or even more importantly, if you're in a large organization and there's opportunities, how do I make sure that those are the characteristics that I'm sharing and making sure I understand what's important to my leader or other leaders? Thank you for sharing those.
Absolutely.
How do you balance humility with ambition? I think because I find you to be a very humble leader, but at the same time, you are able to drive execution and bring change and successful execution for your organization. So how do you balance the two of those things?
I recognize that no one succeeds by themselves, right? Sometimes it truly takes a village. I am very appreciative of the team and the expertise that I'm surrounded with. My goal continues to be to make sure that I am communicating what is the vision, what are we hoping to accomplish, and making sure that we don't forget at the core of it that we're really trying to improve the care of our patients that we're serving. That's our foundation. But I intend to make sure that the goals are understood, that my team does not have barriers to their success, that I maintain those professional connections, and that we build upon those. And from that, I think is how I've been able to, and as a team, we've been able to execute and really deliver meaningful results for the organizations I've been a part of. With ICP in particular, we have a fairly small team, but that team has been able to accomplish things that I have not been able to do in organizations where I've had 500 plus employees, right? So I call them mighty but small. And I think that really comes from a shared vision. It comes from a passion about what we do, a feeling a connection to the mission and the goals of the organization, feeling heard. Well, people have a voice, they want to feel heard, and also having the autonomy to really use their skills to deliver on a service or to deliver on whatever the goal may be, helps to drive us forward and help to drive the success of the organization. And in essence, my success as a technology leader for ICP.
Yeah, I love that. So finally, what message would you share with others that are either at the start of their career or maybe feeling stuck or unsure about their next step?
I would still go back to say being open to something new, being open to change, not closing doors. Sometimes we find that we get out of our comfort zone and it just opens a wealth of new experiences, new opportunities that we wouldn't have thought of that would have been possible. I think early on in my career, someone would have shared with me that you might serve as a COO. I would have probably chuckled, right? I didn't see that in my career path. But again, being willing to step out, take that chance, take that risk, and learn. It's really important. So continuous learning, figuring out how do I improve, how do I get better, having that drive to continue to move forward is something that has served me well. And I think for others that's coming up in the field, that excitement, that drive, that openness, that willing to take a chance is going to also hopefully serve others. And I would also add networking. That's something that is really important. Identifying and learning from people. What do people do well? And there's things that they don't do well. So don't put that in your tool bag, right? So being able to learn and network and build those collegial relationships that's going to help you move forward as well along your journey.
I agree. Saying yes. And if you feel uncomfortable about something and it's outside of your comfort zone, that's exactly where you need to say yes, because that's where you grow. Because if you're always feeling comfortable, then you're not growing and learning. And to continue to grow in your career, you have to continue to learn and put yourself out there, even though it's hard. But once you start doing it, it's like a snowball. You're like, okay, this is hard, but it's supposed to be, and it's going to be okay. I may slip up initially, but I'm going to get it. So I think that's a really important suggestion.
Take that first step and give yourself grace. To your point, you may slip up, but give yourself grace to keep moving forward. That's really important.
Yeah. Well, thank you so much for joining me today. I think you provided us some really great lessons and sharing your journey and how you got where you are. And there are so many that want to be you when they grow up, for sure. I'm thankful that you gave us your time, and knowing you personally, have so much respect for you, and you're just a fabulous human. And that's really what's most important. So thank you.
Thank you so much, Erica. Likewise. So thank you for this opportunity. I've really enjoyed it.
Thank you for tuning in to this week's Town Hall. A special thank you to our incredible guests for sharing their insights. Our mission is to transform healthcare one connection at a time. And these episodes are crafted to bring you perspectives straight from the leaders who are reshaping the industry. Use these discussions as an opportunity to inspire and mentor your team. And if you enjoyed the episode, one of the best ways you can support the show is by subscribing and leaving a rating. Remember, every red light leads to a green light. Thanks for listening.